Well, the best way to teach kids how to read is an issue of active debate right now. And the provincial NDP signaled this week that it is interested in one particular direction. The province is investing $30 million to provide universal screening for children from kindergarten through to grade 3. And for more on this, we have three people with us this morning in studio. Alicia Smith is the Executive Director of Dyslexia Canada. Good morning to you.
Good morning.
Thank you for being here. Rebecca Ashton is a parent of two dyslexic children, and she's based in North Vancouver. Hello.
Good morning.
And your 19-year-old son, Luke, is here as well. Good morning to you, Luke. How are you doing?
Good. How are you?
I'm very well, thank you. Thank you all for being here. It's an important discussion. Alicia, for starters, tell us about the approach that this signals when it comes to literacy then. What's different? What's going to change?
Well, this approach is really grounded in scientific research. So there has been, as you said, a debate about how to teach children to read for a very long time. However, at the same time, there's been over 50 years of scientific research really looking into those big questions about how children learn. So this approach is different because it's really leaning into that research and making sure that the practices happening in the classroom are based on sound scientific evidence.
And what was happening and what is going to happen differently now as a result?
So the previous approach was really grounded in the idea that children will learn to read naturally if they're in the right environment and we read to them and through exposure, with a lot of focus on implicit learning. And the new approach will be more explicit and systematic. So that is helping to break the language down into smaller pieces, explicitly teaching those to children with a lot of intentional practice, working at that smaller level, building up to that comprehension. So it's really more of a structured approach that is more accessible, especially for children who would otherwise struggle with learning to read.
Right. And so will this help identify earlier children who are having trouble reading, children who might have dyslexia?
Yes. So part of the announcement yesterday from the government was a move towards universal screening in British Columbia. And so this is a focus really on identifying early in kindergarten the children who are at risk for reading difficulties due to dyslexia or other factors to ensure that they can get support earlier so that they can build those foundational skills.
Now, Rebecca, for you, I understand that I said it off the top, you have two children with dyslexia, Luke being one of them.
Correct.
What difference would it have made to either of you to have had screening earlier than you had to be able to identify Luke's challenge before you were able to?
Oh, I think it would have been a massive. For both of my boys, the biggest thing is just the confidence that they had in elementary school and knowing that maybe things were a bit different for them and the rate that they could read, the speed that they could read to keep up. So being able to have that earlier diagnosis and then intervention and support would have made a very big difference. These changes that are coming are just massive.
And Luke, for you, describe to me what that was like. I mean, to be in a classroom and to have the difficulty that you had.
It wasn't as hard as I think you would think it is. I think there was definitely a stigma maybe when I was a bit younger, but I've been lucky enough to have very supportive parents and teachers and friends, and that, any challenge that I faced, I had a lot of help with and was able to ask many questions and, be able to talk things through and really be able to find the benefits and kind of superpowers, we call it, with dyslexia.
Well, that's the part of it that I'm always amazed by is the kind of workarounds that people with dyslexia are able to come up with. Tell me what that is like.
I think there's when I was younger, it's a lot of experimenting, just seeing what works for you.
Yeah.
I've always found that routines definitely helped me out, being able to ask lots of questions and, maybe taking extra time than other students. Just having those abilities kind of make a lot happen for me, especially when I'm younger and then also now.
Right.
I think a really big part is as parents is partnering with the school.
Yeah.
And seeing it as, a partnership. We were incredibly lucky to be in the school district, the North Vancouver School District. They're, I think, ahead of their game there in terms of the curriculum that they have, the support that the teachers have, and the inclusivity. So partnering as parents together to support the child made a huge difference for us.
Alicia, I understand that this new approach is it fairly contentious? Is there debate about this?
There is in some circles, I'd say. There's a broad support from teachers,
Yeah,
grassroots teachers in the classroom, because they see firsthand the challenges that kids are having when they're
right.
not succeeding. But there is within people who have been very invested in the old approach to teaching reading, it can be difficult to shift away from that.
Hmm.
So that's really where the debate, if you want to call it that, is coming from. Like there is certainly some pushback in faculties of education across Canada, not just in British Columbia. But there's a lot of support from parents and grassroots teachers.
Right. Your organization, though, has said that in the end, this is going to lead to more equity.
Absolutely, because it's not just children with dyslexia who are struggling. When you look at the reading results for children, there's a huge socioeconomic gap, right?
Mm.
And Rebecca and Luke were very lucky in that they were able to provide support for him, and he's successful.
Yeah.
But a lot of that support currently is coming from private tutors. It's coming from being able to pay privately for psychoeducational assessments.
Right.
And so many families cannot afford to do that or don't live in communities where those things are available. There's a bit of a rural-urban divide there as well. So this will lead to every child being screened within their public school.
Right.
So they can get that support from their teachers.
And do we worry at all about any of the knock-on effects of screening of, earlier identifying, a child who needs help or a child who's dyslexic and having, walking around with that label stuck to them now?
That's a great question, but the screening doesn't actually identify dyslexia. It's not a diagnosis. It's just a flag of risk.
Okay.
So the idea is that the screening gives the teacher information saying, this child is at risk for experiencing reading difficulties. And there's a lot of information that the teachers can glean from those screening tools to help target that instruction. So if children get that intervention and that instruction based on the feedback from the screening and they continue to struggle, then they would go on to have a more fulsome assessment, and then that would lead to a diagnosis. But this screening is really a first step, and it can really actually help to reduce the number of full psychoeducational assessments that are needed.
And Rebecca, you had something to say about that, I can see.
Yeah, I just think it's critically important for parents to understand that having a diagnosis doesn't have to mean it's a label. There's so many amazing gifts that come with having dyslexia. It really is a superpower, like what Luke just said. So many things come naturally and easy, and I think to him, reading and writing are some things that are challenging, but it's nothing that can't be overcome and achieved with hard work.
Yeah.
And just really focusing on the positive aspects of dyslexia and building confidence. It's all about confidence, and with these children being able to be assessed at an earlier age, and parents not seeing it as a quote-unquote disability.
Right.
Being supported and understanding that their children are amazing and unique and can achieve everything that any other child could achieve in life and more because of their unique brain makeup.
And Luke, for you, when you think back, could it have made a difference? I mean, if you were identified earlier?
Yeah, for sure. I think so. Like I said, I've been lucky enough to have a lot of support from my parents.
Yeah.
And I was able to work with tutors at a young age. And I did some testing just kind of on our own, but I think definitely if that was, more so predominant in school, that would be amazing.
Mm-hmm.
But yeah, I've always kind of had that support, sometimes maybe a little more difficult to get, but yeah.
I think I can speak to that having two children. So
Yes.
Luke is 19 and we also have a 16-year-old. Our 16-year-old was diagnosed in grade 2. So in this time frame that they're setting up to have these early interventions, where Luke was diagnosed in grade 6. So we had the opportunity with our younger son to be able to provide him a lot more support and specialized tutoring at a younger age. And I would say that it made a big difference. It's not that Luke hasn't been able to achieve the same things, but that's had to come with more time investment and dedication, where our younger son, because he was supported early on, right when he was developing those reading skills, it did make a bigger difference for him, for sure. It's critical, that early diagnosis.
And we do, though, still, Alicia, we do still have that equity problem because, again, I mean, you've probably incurred a substantial amount of cost that goes along with all of this, and I know this firsthand as well.
Yeah, absolutely, over the year, and we feel really incredibly lucky that we were in a financial position, and we did have great mentorship as parents to support us in going down this path. But if we hadn't had that and didn't have the financial means to do it, my boys would be very, very different people.
Right.
So it's critical what the government's just offered right now.
And so, Alicia, what about that? People who either they don't have the financial means, or they don't have the ability to or the time to advocate on behalf of their children the way some people might.
That's why at Dyslexia Canada, we really approach this as a human rights issue.
Yeah.
Every child has the right to an education and the right to receive the reading instruction that a child needs so that they can become an independent reader is a big part of that. And nationally, human rights commissions have been looking into this issue. And Ontario is one. We had a full public inquiry, and the commission came out with some recommendations saying that the province should move towards the same changes that British Columbia is choosing to adopt proactively. So that's great. But really, it does come down to that. If you can't afford to pay for these things, your child isn't getting the support that they need. They're not learning to read. And it impacts their mental health. It impacts their ability to learn in all subjects. And the knock-on effects go on for the rest of someone's life. So that's why this is so important that the province is committed to implementing universal early screening and really having that focus on early intervention so we can prevent those reading difficulties at school.
What a fascinating topic. I'm so glad you all took the time to come in and tell us more about it. Luke, thank you very much.
Thank you.
And thank you, Rebecca.
My pleasure.
And Alicia, thank you so much for walking us through all of that. Really appreciate it. Thank you.